I believe that most of the patients who have spine-related issues are really afraid of surgeries. So I think it will be a relief to our listeners that without surgeries also they will be able to cure back pain.
Yes, they can contact us. Just they can send a report, MRI report or X-ray report. Everything can be sent through WhatsApp or an email. Then we can check it, and then we can assure them whether it is possible to do without surgeries, or else we can prescribe medicines from here. And all these applications, external applications, massages, and all that can be trained through net or some other devices. Yoga can be advised. So there can be a cure without coming here also. But if the pain is severe, it is better you directly approach us, come here, stay for some days, and get the treatment, get the proper treatment done. That will give a lifelong result for them. That I can assure you.
So the speciality of Vedagram is you provide both online and offline treatments.
That is one speciality, and another speciality is that we have a modern medicine unit. Modern medicine unit. So any emergency can be taken, and that will be shifted to the modern medical unit. Once the pain is subsided, or once the patient is stabilized with if some other disease is there, first we will send it to a modern medical department, and we will stabilize the patient, and then we will take over the patient, and then real treatment of the back pain will be started.
So yeah, Vedagram is providing integrated
treatment for the last 40 years. So we have 2-3 doctors for the modern medicine and 7-8 doctors for the Ayurvedic. So we will be with a common discussion and decision, we will be managing the patients. So there is no controversy in that.
So doctor, you have explained in great detail regarding disc prolapses related to sciatica. And are there any other causes which is associated with continuous back pain?
That is what you are.
Yeah.
There are so many causes are there that can cause, other than the disc prolapse and sciatica, that is a nerve, and we have addressed only 2 issues now. One is disc problems, and the second one is the nerve causes, neurological causes. So many other causes are there. And that one, we have to start from the birth issues. Inside the womb, there can be some problems with the back. So there can be malformations of the back pain, and there can be then some vertebra may not be formed properly while the birth is there. That can cause severe back pain till all of the life. And when they are born, there can be that backbone should be straight. There can be deviation of this straightness during birth, and after birth also it can happen. That when we call that there is a side-based bending, then we call that scoliosis. If it is a forward bending, we call that lordosis. If it is a backward bending, we call that kyphosis. So scoliosis, kyphosis, lordosis, everything can be there. The posture of the child while sitting, if he or she is sitting like this for a long time, that can cause a back pain. And if he is leaning back with school bags or like that, heavy bags or like that, then that can cause a kyphosis. And that can cause a lordosis. And like that, the structural problems of the back can be there. That's a possibility, and we are seeing students with this back pain, this kind of back pain. Then there is a cause of, another cause that is due to the nutrition. Calcium, phosphorus, vitamin D, all these things should be there for the bone to carry the weight. The density of the bone is an issue. The depletion of the density of the bone can be with nutritional issues. That can cause long-standing back pain for the children. So we have to see vitamin D. Most of these children are not exposed to sun now. So there can be depletion of the vitamin D. So that can cause a back pain. Deficiencies are created. Then there is osteoarthritis issues. That is the degeneration of the joints are there. Facet joint, we call that. Between the 2 vertebrae, there is a facet joints are there. When this vertebra is moved, there can be degeneration of this facet joint. In due course, that can cause a back pain. Then we call that osteoarthritic pains. Then some rheumatic diseases are there. Rheumatic diseases, rheumatoid arthritis, that can cause severe back pain with inflammatory back pains. Then there is ankylosing spondylitis, like that these 2 vertebrae that will be fused. The calcium or something else will be deposited between this backbone. Backbone will be appearing as a single structure, like a bamboo structure. That is called ankylosing spondylitis. That also will cause pain. Another cause of back pain is like TB, tuberculosis. That can come that body of the vertebrae. There can be TB, and that will cause back pain. Then these issues like cancer, sarcoma, like that things, that can cause also back pain. Then there are some referred back pain issues. The uterus issues can cause back pain. Then in males, that prostate issues can cause back pain. Then kidney stones can cause back pain. Liver stones can cause back pain. And so many other are there. These are all referred pains. The origin of the pain will be in some other organ, but it will be reflected in back. So the patients will be presenting it as back pain. So many issues are there with back pain. So we have to identify it with X-rays. Either with X-rays, scans are there, ultrasound scans. Ultrasound scan will be there. Then blood test should be done for TB, cancer, and like that things. So we have to diagnose it first. So for that, if the patient is coming here, we will have an assembly of the doctors, the modern doctors and Ayurveda. Then we will discuss the case, and the reason of the back pain will be traced out before any treatment. But if they are coming with a proper diagnosis, it is very easy for us. You have to start the treatment. That is all.